CEN test prep exam in Spanish. Question 1. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be Option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Question 2. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 3. When receiving a verbal or telephone order in an emergency, the nurse should: Option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D, refuse to take verbal orders. The correct answer is option B, write it down and read it back to the provider for verification. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid- position and fixed pupils. Option D, a constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. Question 5. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects: Option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Question 6. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. Question 7. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, a hemorrhoids. Option D, Mallory-Weiss. The correct answer is option B, esophageal varices. Question 8. The most common cause of lower gastrointestinal bleeding in adults is: Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss. The correct answer is option B, diverticulosis. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 10. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, a ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. Question 11. The most effective method to control severe bleeding from an extremity wound is: Option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, direct pressure. Question 12. Carbon monoxide poisoning leads to hypoxia primarily by option A, causing bronchospasm, option B, binding to hemoglobin with higher affinity than oxygen, option C, destroying lung parenchyma, option D, causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. Question 13. A Call's fracture involves the option A, proximal humerus, option B, distal radius, option C, femoral neck, option D, tibial plateau. The correct answer is option B, distal radius. Question 14. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter, option B, prolonged QT interval, option C, Osborne, J, wave, option D, ST depression. The correct answer is option C, Osborne, J, wave. Question 15. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia, option B, hypercalcemia, option C, hypocalcemia, option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 16. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count, option B, elevated creatinine and BUN, option C, decreased platelet count, option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Question 17. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A, no tetanus prophylaxis needed. Option B, a tetanus immunoglobulin only. Option C, Tdap or TD booster. Option D, a tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, Tdap or TD booster. Question 18. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as option A, TSI level 1, option B, TSI level 2, option C, TSI level 3, option D, TSI level 4. The correct answer is option A, ESI level 1. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Le-Fort fractures are classifications of fractures of the option A, mandible, option B, mid-face and maxilla, option C, orbit, option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 20. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner's sign, option B, Cullen's sign, option C, Murphy's sign, option D, Rovsing's sign. The correct answer is option B, Cullen's sign. Question 21. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Question 22. In distributive shock, the primary pathophysiology is option A, pump failure, option B, widespread vasodilation and increased capillary permeability, option C, fluid volume loss, option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 23. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should: Option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C. Treat the headache and continue nitroglycerin as ordered. Question 24. A patient with a Le Fort 3 fracture is at highest risk for: Option A, dental malocclusion. Option B, airway compromise. Option C, corneal abrasion. Option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. Question 25. Ovarian torsion presents with: Option A, bilateral lower quadrant pain. Option B, a sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, a fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea.